Malta in terms of population and 10,000 times in terms of area. So you can understand how tiny Malta is. But the best part is life expectancy is among the highest in the world, which is 82.75 even after COVID. So human development index is well reflecting that, which is almost 9. And unemployment rate is also among the lowest in the world. Okay, so 3.2%. Okay, well, in terms of GDP, we are tiny island, so it must be quite small. But in terms of per capita GDP, it's almost 15 times than India. So that's what we are enjoying here. And okay, 8 times in terms of purchasing power parity. Malta has been the world capital of internet gamings. At one time, 90% of internet games were licensed by Malta, but now different countries having their own licensing system. So the number is reducing, but still more than 50% are licensed from Malta. Also, if you are dealing in blockchain, cryptocurrency, or DLT, most of cryptocurrency exchanges are based in Malta. And this is the first country in the world which recognized blockchain and DLT in its regulations, as well as it is providing almost every services related to that. It's also a hub for offshore banking and favorite location to shoot films. So you can easily see various Hollywood or Bollywood celebrities roaming around the streets. So these are some of the movies filmed here. Okay, but list is quite long, so can't fit here. Okay, so we come to today's topic. And to start that, I'm sure you all are aware about what a system is, okay, and what a complex system is, but I'm just giving you some background. So where multiple entities are interacting with each other, changing the state of the system, or and that interaction and these state changes are modeled as a system. And when there are large number of entities interacting with these, the system becomes complex. Okay, so there are various complex systems. For example, our family system. Okay, this is a famous story of Della and James. They were in love, but poor, wanted to gift each other something on a particular day, maybe 14th Feb. Okay, so Della was having beautiful hair, and James was having very good wristwatch, but Della was needing a hair clip, and James was needing to change his wristband. So they decided to give gift to each other, but because they were not having money, so they decided to sell their possessions. So Della got cut her hair, and James sold his wristwatch. And then they bought the things, gifted to each other, but these were of no use. Well, love was in the air. So that was a happy ending, but it doesn't happen in reality. Okay. Or it might happen once or twice, not every time. Okay. That air might be purified, so love is no more there because of this. So what was wrong there? Okay. They even sold their possessions. Okay. But still that is of no use. So they lost. Okay. So this is a complex system. They were not aware about what is happening at other side. And that lack of knowledge resulted in this. Okay. So how to solve that? Thankfully, with development of AI and various technologies, we are able to resolve these, but not sure if we are ready to resolve these. But yes, there are ways to resolve these. So we can do human behavioral modeling. Okay, modeling the effect of others' behavior using game theory, modeling of cultural, social, economical, financial, and environmental effects using big data analytics, and most difficult is modeling spontaneous changes in sentiments, maybe due to weather, maybe due to the scenario, Okay, there are various things even due to hormones. There might be spontaneous changes. So these, you know, there is one more thing guiding it, the difference between reality and perception. Our perception is made based on our experience, but it is highly suffered by various biases. What are these biases? Let us see that. Okay, so about that, very well said in our holy book, Srimad Bhagavad Gita, Karmandevaadhikaraste ma phaleshu kadachan ma karma phale tu gurmushango astvi karmadi, means your deeds, okay, cannot decide the outcome. So you should not too much think about the outcome. Or in other words, there is no direct relationship between cause and effect. Is that true? Yes. Why? Because there are various factors resulting in a particular outcome. So not just one. Okay, so they are saying if you know one factor, you can't decide the outcome. There are various factors. And here, lack of knowledge plays a role. So all scientific development has been to identify these factors, even in IT or AI. And yes, AI is saying, and that's the very basic definition, okay, is you can model many factors which you are not experienced or aware about. Say, for example, hidden Markov models, and there are various techniques. We are coming to that soon. So, the reality or the outcome is dependent on all these factors. Our perception is considering only few factors. So, our perception is highly biased. Okay. So, the very first algorithm in artificial intelligence is hill climbing algorithm. I'm sure most of you are well aware about that. But this is also saying many, many more things which you might have ignored. Okay. So about our behavior, if you are staying here, you can see only this. You can't see this. Okay. So whatever decision you will make will be based on this local maxima. Okay. So you might start thinking that this is the global maxima. Okay. This is the highest peak in the world. So you are already biased. You can understand because you are not able to see this. Okay. So if you want to decide, you want to climb the highest peak in the world, you will plan for climbing this. But as soon you come here, you will realize no, there is another peak. Okay. There is also a valley. You have to go down as well, not just up. Okay. Then you might also think, okay, this is the lowest valley in the world or deepest one. But that is not true. This might be another deeper valley. Please interrupt me if you find any difficulty or there is any issue with voice or video. Okay. I can again ask, are you able to see these slides and listen me?
Yes, sir.
Okay, thank you. So you can see this, okay, how the information is playing a big role, okay, or your knowledge is playing a big role in your decision making. Okay. And this is also affecting your behavior. Okay. How is that? Okay. So if you do not know about that, okay, and someone told you, okay, on this is not the highest peak, there might be another peak. Okay. Then that might change your behavior. You might start disbelieving yourself. Okay. Or you might start thinking there is huge uncertainty. I don't know what might happen next. Okay. So you will take short-term decisions. You will not consider the impact of these short-term decisions on your long-term well-being. Okay. So for example, in India, this is okay, and this is the difference we can consider in many countries. Okay. Because of that, okay, so if we have less stable institutions or there is more uncertainty, our decisions are for very short term well-being. Okay. So for example, there are many people who are casual about their health, casual about their behavior. For example, if you are driving a car, okay, you will start driving it fast, avoiding various regulations, just because you do not consider what might be the consequence of that in long term. Okay, because you do not have very good knowledge, okay, or there is huge uncertainty. So why should you prepare yourself for long term if you do not know there is something in long term, or you will be able to see that or not? Okay, that is okay. Life expectancy is low just because of these things. Okay, now you can see another example, very interesting example of 24th of February 2022. This is something special. What happened on that date? You might be aware the war erupted between, or whatever you call it, war or not, between Russia and Ukraine. Okay, special military action or war, whatever you call it. Okay, depending on which side you are. Okay, but the interesting thing happens in the global financial markets. Usually, we see Nasdaq. You can also see commodity market or cryptocurrency market or any other financial market, currency market. Okay. So the interesting pattern we have seen is, okay. So here, okay, you see the market is going down. Huge crash in Nasdaq before the war erupted. Okay, but as soon the war erupted here, okay, for maybe 2-3 hours it is stabilized. Okay, but then the market started celebrating and it went even higher than what it was before the war. Okay, why is that? Quite be surprising if you say, okay, Nasdaq might be like that. Okay, and that you can see how much crash it have seen, almost 15%. Okay, so you can go for Dow Jones. Okay, another financial indicator, financial market indicator. Okay, so you can see almost 10% crash in Dow Jones as well within few hours. Okay, but again after that they started celebrating. Okay, here the similar pattern. Why is that? That's quite surprising. If war is happening, the market should crash. But no, because here they were uncertain. They were not able to see if the war will happen or not. So due to that uncertainty, they were taking short-term decisions. Okay, so if war happens, we should protect our money. Okay, so we should sell. They sold, okay, most of their shares, but as soon war started, all right, now we know what is the future. War might continue, war might stop, but it might not get worse than that. So let again take our position. So they started buying again because there was less uncertainty. So not only financial markets, everyone hates uncertainty because uncertainty affects you badly, because it makes your decision wrong. Okay, or you are not able to make right decision. Okay, so whole artificial intelligence, or more precisely machine learning, is developed for understanding the uncertainty and minimizing that uncertainty. So interesting analysis we have done, and we found, okay, how stable a country is, okay, will decide if the country will be developed, undeveloped, or developing. Okay, so you can see if you have only little knowledge, okay, there is huge uncertainty what might go after that. So for example, you are certain about next month, next week, I don't know, year, then you will take decisions in short term which might harm your long term well-being. Okay, while if you have more certainty, you will take longer term decisions. Okay, and if you have even more certainty, you will take very long term decisions which will definitely help your country. Now how these decisions will help, we will go to another algorithm, greedy algorithm. So here if you have less information, so this is well known algorithm called traveling salesman algorithm. I'm sure you all have already gone through that? There is something. Hello, there is something. Should I continue? Hello, hello. Should I continue, or there was some noise?
Yes, sir, you can continue, sir.
Please continue, sir.
Okay, thank you. Okay. So, this is well-known algorithm, salesman algorithm. So, there is a salesman who needs to visit 5 cities, okay, other than the city he is already there or she is already there. Okay. Now, if there is huge uncertainty, we can explain. So, only about the next city. Okay, so the distance from the to all other cities, but he's not aware about the distance between each city. Okay, then he will just travel or decide to travel the nearest city first. Okay, so he will go for nearest city and then you will decide which city he should go next. Okay, so here he decides to go here, then here. Okay, so the nearest one every time, nearest one, and then okay. So this way you can easily see he will take far longer than if he planned that journey well before starting the journey. Okay, so then he can guarantee that he will travel the least amount of distance. Okay, so you can easily see this is wastage of resources, wastage of, yeah. So obviously, if you are taking more resources, it might affect the outcome or the benefits. Okay, because some benefits would be eaten by more resources. Sorry, there is another again noise. Okay, so you can easily understand. Okay, based on your knowledge, okay, or lack of knowledge, you will develop various biases. Okay, for example, optimism bias. Okay, so during COVID-19, you might have seen people started thinking COVID-19 can kill everyone else but not me, or can affect everyone else but not me. Might not be rational, you can understand. So they started opposing various measures taken for COVID-19 because they feel they are prone to disease. While some are having pessimism bias, so they started thinking the world gonna end. So last goodbye I should say to my family. Okay, and they started moving without knowing where. Okay, so these are two popular biases affect our decisions. You might have already seen during COVID-19 how badly these decisions affected us. There are many other biases. Okay, so I'm not reading these. Okay, you can read these biases. Okay, but you, while I'm writing to know how many these biases are. Okay, for example, it was extremely difficult to understand exponential growth at the time of COVID-19 growth. So this was exponential growth bias. Okay. Then also we were running for conformity bias during COVID-19. Okay. Ambiguity bias was also there. Okay. Status quo bias was also there. Okay. But we did it at that quite a lot during COVID-19. Okay. So you can see large number of biases. And again, this is not an exhaustive list. There are many, many more biases. Okay. So why I'm telling you this? Okay, because our biases can affect our prosperity, our nation's prosperity, our world's prosperity. Okay, because it affects our decision making. So it affects our daily activities as well as long-term impact. Okay, so we can see this with some other examples. For example, our economy. Okay, so our biased approach is simple: demand and supply rule. More demand than supply, more profit. Okay, or price will be higher. Is that true? Let us see. So more profit means the industry will become attractive. You know, if there is a shop earning a lot, everyone will start opening a shop. Okay. So what might happen with that? Okay. So there will be more players. Okay. More players means more supply than demand. Can take you that shop example little bit further. So if you are having a shop, okay, and in any shop there is a fixed cost and there is a recurring cost. So to meet that fixed cost, you have to have minimum 100 customers, just for example, and you are actually getting 150 customers or 140 customers, just again for example. Now, because of you are making huge profit, there are two more shops started. Okay? Now, these shops are getting very little number of customers, like only 20 customers each. In that case, you will lose because your profit will be eaten by these two, and they will also lose because there is a break-even point. They need 100 customers. They are only getting 20 customers, but at the same time, you are also losing. Okay, so there you might follow other measures to attract customers by reducing price, less profit, and even you might require to leave the market. So more demand than supply might not help you many times. Okay, so our biasing is very short-sighted. Okay, this phenomena is short-sighted. Long-sighted, it might affect you badly. Okay, so more, and the result will be again more demand than supply, and this will be the cycle. Okay, so let us understand our healthcare system, because my research area mainly focusing on healthcare system. So we can take our healthcare system as a complex system. So there are two types of healthcare systems. Although there might be many more combinations of these or supported by insurance. Okay, but mainly two types. Okay. Private healthcare system. Well, some patients want cheap healthcare. Some noise. Let us just wait to this noise to be settled down. Or you are able to hear me even after this noise? Okay, so let me continue. Okay, ignoring this noise. So some patients want cheap healthcare. Some patients want best or luxurious healthcare. So your duty is to satisfy both customers. Sorry for that noise. I don't know from where this is coming, but yes. Okay, now there is no noise, so good. Okay, so some patients want best healthcare. So you might start a private hospitals catering both. Okay, so but healthcare providers or hospitals aim is to have profit. Okay, if they do not have profit, okay, and sufficient profit, like okay, because they are investing money, if they can get more profit in any other business, they won't invest money in this business. Okay, because they are private players and they are there only for profit. Even if they are just for charity, they might not survive long. You know, they might not meet expenses if they are not generating profit. Okay, so maximum profit means maximum hospital visits. Okay, so each patient will pay for that. Okay, so maximum hospital visits and might result in readmissions. So you are not completely cured, so that you need to come again, as well as if you are paying per day or you are charging per day, then maximum hospital duration of stay. Okay, now we can say another example for this is, okay, again you started a hospital. Now for hospital you need a surgeon. So you found a surgeon and you offered him a salary, I don't know, 100,000 rupees per month. Okay, or I'm not exactly aware about what is the salary there in India, but that's the approximate salary I might expect. Okay, so 100,000. Okay, now if the hospital is charging 5,000 rupees to each patient for that surgery, to meet his salary, the hospital needs at least 20%, but there might be many other expenses. So to meet that salary, hospital needs at least 40 patients. Okay, just for example, there might be 50% other expenses. Okay, now If the hospital is not getting these 40 patients, what they might do? They might fire that surgeon because they cannot pay to that surgeon. What might happen? So they might either force the surgeon to do some surgery even if this is not needed, or discontinue the job. Now, which might be a better situation for the society. You can think about societal point of view. If the surgeon is not getting sufficient salary or whatever, okay, and he needs to leave the job because the hospital is not getting sufficient number of patients, then that locality might not have a surgeon. So patients might lose their life. Okay. Another situation is the patients might need to go through surgery even if that is not absolutely necessary, okay, because of recommendation to sustain that surgeon. So the situation is quite complex. No one can say this is the better situation or that is the better situation. Everyone might have a his or her own opinion, but this is the situation many hospitals are coming or facing these. Okay, and it is quite easy for anyone to point, okay, surgeon is or hospital is charging too much or they are doing surgery unnecessary and all these. But you can easily see other side of the coin if you want, okay, if you are not biased. Okay, so that's the biasing. Another, we can see public healthcare system like in Malta. Even in India we have both public and private, but here also we have private healthcare system, but public healthcare system is among the best in the world. Okay, so among top 5 healthcare systems in the world. So that's why I was talking about Malta. Okay, but you can understand we are paying almost 30 times more per capita on healthcare than India. Okay, so that's why this system is better. Okay, I can give you more perspective why Malta is giving priority to the health. Malta is the first country in the world. Okay, in 13th century, during the Black Fever spreading across Europe, Malta is the first country which recognized Black Fever as an infectious disease. Or you can say, in other words, Malta is the first country in the world which recognized there is something like infectious disease. And they started special rooms far from the community or population areas, okay, to keep these patients so that they do not spread the disease, as well as they started putting cross on the houses where they found any such patient so that people can avoid touching the, interacting with them physically to avoid this spread of the disease. And yes, it worked and they were able to control the disease better than any other European country. In fact, even India got affected and lost many lives. Okay. So, okay. We have, that's why we give priority to the health. Okay, so even during the Second World War, okay, from friendly countries, okay, these warriors wounded during the war used to come to Malta for treatment. Okay, so even during the nights time when there were wars elsewhere, they used to bring patients here or wounded warriors here for treatment. Okay, so that's why health has always been a priority, and we are spending a lot on healthcare. Okay, and because of that, we are also the most favorite medical tourism destination across Europe. Okay, so we used to receive patients and we treat them here. Okay, so healthcare industry is developing very well, and that's why we also have many private hospitals treating international patients. Okay, so health providers want minimum cost because they are supported by taxes and we can't charge infinite tax. Okay, so for minimum cost, we spend less on resources, so we have scarcity of resources. Okay, and for that, we try to make beds available for next patient, so least duration in hospital as well as minimum admissions or minimum readmissions. Okay, Now, if we have minimum admissions, there will be a waiting list because we are not admitting everyone at the same time, okay, because of limited resources or bed availability. Okay, so we might ask patients to wait for next bed available. Okay, now because of that, we might discharge patients early, so they might need readmissions later on because they are not fully recovered. So this waiting list might become longer, longer and longer, and sometimes ever increasing waiting list. Like when we were working in the US with, in the UK with NHS, we realized there were targets of 9 hour medical attention for emergency and 3 weeks medical attention for other type of treatments, but we were not able to achieve that. Even 16 hours we were not able to achieve for emergency. Okay, so, and still the country is struggling. Frankly speaking, still they are not able to achieve that goal. And I'm talking about 12 years back, they were not, and still they are not. Although they spent far more than they used to spend at that time to deal with this problem, but still they are not able to properly achieve that goal. Yes, somehow some progress is there, but not completely. Okay, so longer waiting list means some patients might die without getting medical attention or waiting for getting the medical attention, or their condition might go worse. And easily say this is a poor healthcare. Okay, and so there are various countries which are having government healthcare system facing this problem. And you might have seen during COVID-19 time, India also faced this problem, but UK, the US, France, Italy, Malta all faced this problem, okay, of longer waiting list and public outcry because of that. In India, you might have seen, but also here and everywhere in the UK also. Okay, so to deal with that, what might happen? Okay, at COVID-19, there might be a call from a minister. Please treat this patient. He is my colleague. He is my, I don't know, friend. He is my relative, whatever. So doctors are forced to use preference, or doctors might come with some other preference measures. For example, the patient who is having worse condition. Now, all right, how to find out which patient is having a worse condition? That's a problem. Here in Malta has been a case, quite controversial case, where during COVID-19, one patient was advised to stay at home because of less number of beds available, and they were treating more severe patients. And she died at home um, because they didn't realize she is also a severe patient. So that's another challenge, how to find out which is the more severe patient than others, having a or needs urgent attention than others. Okay. So some type of preference we or priority system we need to apply, but that's a problem. Which priority system is the best? Okay. If you don't apply priority system, what might happen is there might be huge crowd outside and you will not be able to decide which patient you should treat first. If you are deciding, then this is a priority system. And that way, this is everyone will not get the same health care. So you can call it corruption. Okay. You might easily say, and that is what told during COVID-19 time, why don't we add more resources? All right, we can add more resources, more cost, so more tax on public. Okay. You might have a shorter waiting list. Okay. Longer hospital stay. Okay. So minimum readmissions. Then there might be more patients. Now, there were two problems we have seen during my work at with NHS and the UK. What happens is if you have more longer hospital stay, there are longer chances or more chances of getting hospital acquired infection or suffered with medical errors. So casualties might increase at the hospital, while there might be some patients which actually do not need medical attention, but because there is less waiting list or no waiting list, they might seek medical attention. Okay, this phenomena is sometimes called care holidays. So what happens there? There are various um, elderly or dependent patients which are having some carer taking care of them, but um, carer needs some holidays. They cannot continue working forever. Okay, for that, when these carers need holidays, they can go to the hospital. Okay, now if they are not having any medical issue, hospital might not admit them, so they might sometimes artificially create medical issues, and these might be fatal. Okay, so and underutilization of resources might be another problem. Some vets are empty. Okay, the first thing is because the admission rate is highly stochastic, like there might be a time for few days or few hours depending on which size of hospital is. You might not have any patient, and there might be time suddenly large number of patients arriving, and you can almost never satisfy all patients. Okay, because of this stochastic nature, so there will definitely be some waiting list. Okay, so if you add more and more resources, not necessarily we will be able to serve patients. Okay, and there might be a misuse of these resources, and that will build up more and more cost. So again, some waiting list. Okay, so what might be the solution? You might continuously calculate optimum resources required by using simulation and various methods. Okay, by collecting more and more data. Okay, and then for that, you might also calculate optimum waiting time, optimum hospital stay, minimum readmissions, okay, optimum patients numbers. Okay, so to avoid readmission, for example, I have seen in again in the NHS, okay, there has been patients staying for 16 years at the hospital, because they were not ever fully recovered. So, and because of, like, they might need readmissions after some time, so they kept him at the hospital. So that might be not optimum. So we have to find the policies which are making things optimum, again, by using simulation and modeling. So optimum patient numbers hospital can treat, even the optimum location of the hospital, optimum number of hospitals, okay, optimum utilization, okay, and minimum misuse, and optimum cost of, okay, and some waiting list. So, and these are not one size fit all. Okay, or you can do it one time, because of population dynamics is changing, even disease dynamics and all these scenarios are changing, so you have to continuously remodel it, and if needed, adding resources. Okay, and now here also resource addition should be optimal, in the sense, like here in, even in Malta, we have seen the scenario where they added more beds, but they were not having sufficient number of healthcare professionals. Okay, so even like if you add more doctors but you didn't add more nurses, so there might be some imbalance, and that might create all these problems. Okay, so you have to do proper resource requirement forecasting, admission rate estimation, and length of stay estimation you should use for resource requirement forecasting. Okay, and you might also use other means of providing care, for example, preventive care. Okay, or, okay, we will come to that very soon, is digital twins, which is part of this talk. Okay, yeah, just let me ask you, are you getting bored, or let me continue, or if you want a break for 2-3 minutes or 5 minutes, I can, you can just let me know so that we can continue with this.
No issue, sir. You can please continue.
Okay, thank you very much indeed. So we have to understand these are the challenges, but there are more challenges. Okay. So health challenges are obesity and chronic diseases. You might have seen, no introduction is needed for this. Aging and ever increasing health resource requirements. So thanks. Uh, we are having high life expectancy, but then we are also needing more resources. Okay. And yes, it is also important, not just life expectancy should increase, healthy life expectancy should increase. If there is not the exact or more improvement in healthy life expectancy, health resource requirement will further increase. Then there are more problems just due to healthcare systems. So drug resistance, so many are developing drug resistance, and it is expected by 2050 more than 50 million lives can be lost because of this drug resistance. Okay. Hospital acquired infection, this is another problem. Okay, so many like MS, there are many hospital acquired infections. Okay, even 19, at least in Malta, started as a hospital acquired infection. So you know, um, that is taking even lives. So and the another problem is medical errors, and unfortunately huge number of patients losing their life or getting their condition worsened just because of medical errors, because they are human. So errors, like two errors are human tendency, or human can do errors, even machines can. Okay, so another problem increasing the resource requirement because of diseases is global warming and pollution. Okay, so for example, 15,000 lives were lost last year due to global warming in Europe only. Sorry. Okay. So in Europe only 15,000 lives were lost due to global warming last year, or heat waves last year. Okay. So that's a huge number, but not in many other countries, these numbers are very high. And pollution. Okay. So we are emitting almost 37 billion metric ton of carbon, which is affecting all of us, and many diseases are there and taking lives. Okay, so again, this is a problem. Okay. Another problem is very interesting, especially during COVID-19, we came to know is health inequality. So you are healthy only if someone in China, the first person who got infection of COVID is healthy. Otherwise, he or she can infect you, even if you do not have any connection with him or her. And to ensure that health inequality, you need healthcare finance, so that everyone is getting access to healthcare. Okay, so not only in China or any particular country, like there has been diseases across globe in almost every country, and infectious disease affect globally. So even if they started at one place, so if that place is not having good healthcare facilities, it can easily spread the disease. If it is having a better healthcare facility, if not completely containing the infection, they can slow down that infection or make it locally only. Okay, then also we need information sharing to deal with that, information exchange, especially healthcare information exchange. Okay, then infectious and genetic diseases, well, no introduction needed. COVID-19 is an example, but Ebola and there are many others, and viruses. Another problem the world is facing is stress and sleep apnea or psychological health. Okay, so this is becoming pandemic, and believe me, stress and sleep apnea has taken more lives than COVID-19, even during 2020 and 2021 or 2022. Okay, so this is also responsible for many other diseases like chronic diseases, okay, hypertension, and even accidents, crime. Okay, so we need to deal with this, and which is emerging or evolving healthcare domain now. Okay, and to relate it to this, there is another challenge is relationships and social health. Okay, so your relationship can decide, or your, the society or community you are living in can decide your health. Okay, if your boyfriend, girlfriend, or wife, or even family members are not having good relationship with you, you can easily understand how it can affect your health. Okay, similarly, if, for example, okay, in your particular community, there is huge crime that might affect your stress, sleep, you know. So social health is needed. Even okay, you have a social connection with someone far from you, still, if you are having discussion, it might affect your stress or sleep. Okay. So this is important to understand the relationships, we call it connection network, okay, and how these can affect your health. Okay, so this is another evolving area of healthcare, so far not given much attention, but now it is getting more and more attention, especially after COVID-19. So these are not just medical problems, but these are also affecting our society, or society can affect our medical problems. So these are having social dimension, political dimension, cultural dimension, community and dimension. Okay, even this might be a communication problem. Okay, as I told you, the information, proper information exchange might have helped containing COVID-19 early. Okay, so it might be communication problem, transportation problem. For example, transportation systems are generating lot of carbon emission, but even accidents are happening because of that, and many other issues happening. So also to provide proper transportation to the hospital, sending patients to the hospital, proper transportation facility might help. Even resources transporting to them might help to deal with, or might help how the patient will be recovered. Okay, so this might be a management problem, supply chain problem, administration problem, education problem. Even your knowledge can affect your health. Financial problem, economical problem, behavioral or psychological problem, geological problems. Okay, I can go to education problem against many are even okay. Our education system is not giving too much attention to teach you basic health knowledge, okay, or health education. And many, even I find it challenging to make the right decision about our own health. For example, if someone is having chest pain, what should you do? Should you just treat it at home, go to the hospital, call a doctor, or I don't know, call ambulance, call air ambulance? There are various options, and it's difficult to decide which option you should go for, because we have not given proper health education. Okay, so health literacy is a challenge. Okay, and that is another domain we are working. So what are the solutions? Okay, so health literacy is obviously, but yes, we need an efficient mechanism or system. So you can easily understand this is a complex system because various domains are interacting with each other. So we need an efficient mechanism or system for acquiring, collecting, analyzing, sharing information from different domains of this complex system for decision making to fight these health challenges and monitor the progress. Okay, so we need an extended health intelligence. Okay, I'm not sure if you are well aware about this term, but let me explain you what is extended health intelligence. And before that, we can see various other technologies we can use to deal with the challenges. So we can use sensor networks to collect data. We can use 5G or 6G to exchange data, cloud computing to store data. Okay? Then robotics to actually work on our decisions. Then some medical developments possible due to technology again. So gene editing, genomics, epigenomics, proteomics, and metabolomics. But most important among these is globalization and economic growth to support all these developments. Okay. Otherwise, without globalization, these developments might be locally. Okay. So others might not get benefited, and if you do not have economic development, you might not finance these developments. So these are needed, and we have to understand more extended health intelligence. What is that? Well, we can go back to basics. What is human intelligence? We collect knowledge through our five senses, or maybe from books, or now from internet. Okay, but this is limited. We can't collect infinite knowledge, and many times it might be incorrect. Okay, there has been movies where you what you see might not be true, like you are seeing something happening on television, but you perceive it, okay, this is happening on actuality. Okay, or what you hear might not be correct because of synchronization problem between what you see and what you hear. Okay, so like a gunshot might be from again from a television. Okay, but you might perceive it as a actual gunshot, so you might not take the right decision, and there might be some incomplete information collected. Okay, so missing data, so you will process it. Okay, so you have limited capacity to process this information. Okay, and even that might be biased, as we have already seen, and based on that, if you take decisions, okay, you might have limited opportunity to understand if these decisions are correct or wrong before actually implementing these decisions. Okay, because you can take only limited action, so you can get limited feedback, so you won't learn much, so your learning will be limited because you mainly learn through either by getting previous rules or information, or through your own action and feedback. While in case of extended intelligence, you can extend this by using various tools. Okay, for example, data collection, you can use IoT sensor networks. Okay, so you can collect unlimited information. Okay, you can use as number of IoT devices as you want. Okay, and you can also ensure that information is complete and correct using various methods. Then you can process that through various technology AI methods. Okay, for example, feature extraction, selection, classification, pattern recognition. Okay, natural language processing, computer vision. Okay, so these are some. There are many more methods. Okay, and you might have um, supercomputers, you might have distributed computing, you might even employ as many number of machines as you want to process that information. To ensure that information processing is unbiased, you might have many checks, and then you can simulate, so various actions can be taken. So you might make unlimited simulations, so you can have huge learning, okay, which is called reinforcement learning. If action taken was not giving intended results, so you change that. Okay, so you can easily understand how it in extended health intelligence can empower you. Okay, health means, okay, in case of health, if you take huge extended intelligence, this is called extended health intelligence. Okay, so this extended health intelligence, IoT, and all these technologies can be combined together to make digital twins. Okay, and when you use them for healthcare, these are healthcare digital virtual health twins, or digital twins in healthcare, or whatever you digital health twins, whatever you call it. So do you want to forecast the number of hospital admissions to ensure bed availability, to estimate waiting time, to have healthcare professionals available, analyzing climate change impact on public health, okay, or to understand the risk to suffer from various diseases or disease risk, okay, so that you can minimize it, Okay. You can also assist correct diagnosis, or you can better take care of your own health and others' health, obviously. Okay. You might also estimate how long a patient will stay at the hospital. Okay, so that you can do a better capacity planning. Okay, even discharge planning to avoid discharge delays and optimize resource utilization and management. Okay, you might also be interested to control disease outbreak and spread. Okay, so you might try to understand the impact of various factors, including weather, on disease spread. Okay, you might also prepare healthcare system based on your prediction about this outbreak and spread. You might also make public health policies to better deal with these outbreaks and spread and alert public. Okay, so how can you do that? Well, using digital twin. Okay. Or first, you will use predictive and prescriptive analysis in healthcare. So, what are these? Okay, you will use collect data from as many sources as possible. For example, weather data. Okay, your own data like genetic makeup, present health status, environmental factors, diet, medicine, sleep, stress, lifestyle, activities, exercise, therapy, relationship, okay, and economical status, even educational status, to understand your disease risk. Okay, so you might predict someone might get that disease after some time, I don't know, or you have this much risk of getting particular disease. Okay, and based on that prediction, you might prescribe to avoid these diseases. Okay, so you might prescribe to control environmental factors, for example, weather. If, for example, sunlight is affecting you badly, or less sunlight is affecting you, then you might be prescribed to have more sunlight, or similarly, pollution is affecting you. You might move to a place where there is less pollution. Similarly, geography is affecting you. You can move to another place. Diet or medicine you might take, okay, or you might take more or less sleep depending on whatever prescription is needed. So they might prescribe you exercise, therapy, medical tests, investigation, treatment, surgery, gene editing, okay, precautions and monitoring. So that's called prescriptive healthcare. Okay. Now, if you combine these two and then you simulate the impact of various interventions, including all these, okay, so be various prescriptions, okay, before actually giving you prescription, this is called digital twins. So digital twins are digital representation of human physiology built on computer models in which data relating to both the individual and the population are introduced. The use of digital twins in healthcare is revolutionizing clinical processes. You might have seen, even you can avoid various problems. For example, hospital acquired infection, medical errors, okay, even drug resistance, and all these. And you can also use and ensure optimum utilization of hospital resources and hospital management by enhancing medical care with digital tracking and advancing modeling of the human body. So these can also help physicians optimize the performance of patient-specific treatment plans. In fact, what we are envisaging or aiming to is patient might not need any treatment in the future, okay, or might not access healthcare systems for the treatment, but there will be preventive care, so no one will ever get any disease. Okay, or if there is a high risk of a particular disease, instead of going to the hospital, hospital can call you to let you know, okay, these are the possibilities of disease and you can prevent them or avoid them, or we can come to you to give you the treatment. Okay, so for that you might need data on physical properties. Okay, and then you might develop some algorithms which we are developing. Okay, then all these, okay, sensor data and performance metrics and environmental data we will use, and historical data, okay, to develop these digital twins. Okay, so we will make a layout, then okay, resources we will provide to that, both equipment and personal and process and workflow. All these software development processes we will do. Okay, so these are the data we will use, but more data, okay, historical data as well. Okay, so these are some of the diagrams, and so these are all data we will need for our digital twin. So okay, and it can help predicting health status, predicting disease risks, recognizing unexpected health changes, identifying factors affecting health, determining the most affecting treatment, therapy, behavioral interventions, dietary interventions, improving patient monitoring, disease warning, patient education, improving physician patient relationship, predicting resource requirements, ensuring resource availability. Okay. So, we are having focus on prevention instead of treatment. Okay. But if when prevention is not possible, we will get treatment. So, complete system is called disease management. Okay. So, reducing hospital visits. So, reducing hospital cost, facilitating affecting telemedicine. Okay. We are also working on developing a new system called medicine, a new concept called medicine as an open loop system. So it is not just patients are coming to the hospital and getting treatment, but throughout their life, even in community or whatever they are doing, they will get medical prescriptions even before they actually ask for, okay, or before they actually experience any disease or symptoms. Okay, so better personalized medicine. Okay, because we'll collect data about individuals, so that individual will get treatment or intervention based on his or her individual status. Okay, reducing medical errors, controlling drug resistance, controlling physical hospital acquired infection. Okay, then reducing insurance premium because you won't need much medical treatment, so insurance premium might get down. Developing and sharing patient life log. So whatever information we collect throughout his life. Okay, promptly recognizing and containing infectious disease outbreak. Okay, so for that, just a few examples we can take. For example, we can collect data through weather monitoring stations and satellite about weather and pollution. Okay, so this is the project fund part of digital twin earth project. Okay, a large project where we are not only making digital twins of individuals, we are making the digital twin of this complete earth. Okay, so this is funded by um, the National Space Fund, okay, of Malta, in collaboration with the government of Malta, okay, and Malta Council for Science and Technology, as well as European Space Agency. So this is the total fund we received, and yes, we hope to get it topped up by the same amount this year, okay, so that we can continue. Okay. So the objective of this study is to monitor environmental factors, okay, which can affect our health. Okay, but yes, this is part of the larger project, the digital twin of Earth, which is having um, which is actually being developed by European Space Agency. So it will create an Earth observation into the creation of a digital twin of Earth. Okay, so means all activities happening on Earth will be electronically or simulated. Okay, so that we can see the impact of various activities we are performing. We can better prescribe. Okay, for example, global warming. So we can find out various factors affecting global warming, and then how we can minimize them and how these minimization will affect. Okay, so we are using a holistic approach. Okay, so accurate modeling of the earth. Okay, and monitoring environmental threats like rising sea levels, increasing ocean acidification, or more intense extreme events like floods and heat waves. Okay. We will also study the environmental activities like forest erosion, hydrology, Antarctica food systems, ocean and climate hot spots. Okay. And we will also observe near future effects of climate change on Mother Earth. Okay. So these are application of digital twin Earth. Okay. So in aerospace, healthcare, wind farm, automobile, and manufacturing, but there are many, many more other applications. Okay. So this is describing our project and digital twin of Earth in more detail.
Our Mother Earth.
Are you able to hear this?
Solar system
Are you able to hear this?
Yes, sir. Yes, sir.
takes many
Okay.
species, including us. Complex life on Mother Earth requires stable conditions to flourish. But due to the access-human interface on Earth geology and ecology, many global problems are introduced like global warming, rising sea level, forest erosion, and many more. As a result, life on Earth experiencing instability. Health Organization discovered that 3 million deaths a year are caused by air pollution and is recognized as a contributing factor in the onset of heart disease and cancer. Along with the air pollutants, we must consider other environmental factors like temperature, humidity. Air temperature affects air movement and thus the movement of air pollution. Because energy from the sun is absorbed by the Earth's surface, air near the ground is warmer than air that is further up in the troposphere. The warmer, lighter air at the surface rises, and the cooler, heavier air in the upper troposphere sinks. This is known as convection, and it moves pollutants from the ground to higher altitudes. In the case of humidity, it is a combination of dry air and water vapor. The degree of combination of this duo ultimately determines how hot or cold the temperature is. This scenario comes alive when we feel intense body heat and skin irritation or shivering uncontrollably. High humidity increases the rate of harmful or toxic chemicals in the air. It also causes dust mites in our homes, dampening air quality. Bacterial and viral organisms that cause respiratory infections thrive due to high and low humidity. Low humidity also causes airborne germs. This entire scenario leads to critical situations which are not only harmful to humans but also to other species. We need to find a solution that stabilizes the conditions and leads us towards a better world that everyone deserves. The Digital Twin of Earth project is among the promising technologies that will provide the solution to save our Mother Earth. Suppose we succeed in implementing fusion of digital twin of Earth and digital twin technology in healthcare. In that case, it will highlight the effect of the Earth's changing environment on particular human replicas. We can digitally create an Earth-like climate to examine its internal and external impact on the human body with the existing health conditions. GIS can be used to explore collating open data to develop a digital twin of city air quality to inform public understanding of health issues, find ways to improve air quality, and move towards a healthy breathing city. We will be showcasing the impact of rapidly integrating multiple open data sources into an interactive digital twin using our cloud-based real-time simulation platform. In other words, healthcare scientists can tackle what-if scenarios without affecting the safety of individuals. The information that this project will generate, not to mention the insights that it will reveal, could drastically improve society's understanding of the challenges and risks of air pollution. More importantly, we will present multiple ways for reducing air pollution and allow cities to understand the importance of green energy, sustainable transport, e-waste management, e-mobility, and vegetation management. Moreover, every government needs to assess the air quality targets which are allocated to cities on an annual basis. Our little initiatives will make a huge difference for our future generations. We urge you, let's work together to make our Mother Earth livable and beautiful. After all, it's incredible in the universe. Our Mother Earth.
Okay. So, and this is more about our particular project.
Have you ever experienced a changing weather effect on your health? The answer is not that much simple. Changing weather can have a long-time adverse effect on human body. We proposed Destination Earth project that intends to identification of primary climatic factors influencing public health, characterizing the impact of weather factors on the hospital admissions and patient length of stay, modeling correlation between the satellite imagery and weather stations data, Develop a public prototype satellite-based health monitoring and resource requirement forecasting tools. Sentinel-3, Terra, Aqua, and EUMETSAT satellites will collect land surface temperature while health data was collected from DHIR. A novel holistic approach is developed to process the datasets and forecasting. We are expecting a novel tool that can predict the hospital admission rate and patient length of stay by considering weather factors. This project not only discloses the crucial effects of weathers on health, but also help us to improve our health facilities.
All right.
you ever-
So I'm not discussing this in more detail because we have already seen in that video. Okay, so we are actually collecting all discharge data of all patients across the country. Okay, so fortunately, being a tiny country, we can easily collect that data from Matarde Hospital, which is the largest hospital in this country. Okay, so and okay, the partner is DHIR. Okay, so we are using various AI methods. Okay, and image processing and image analysis, data modeling and classification techniques. Okay, and prognostication and regression techniques. Okay, so these are the techniques, you can read them. Okay, but yes, these are not exhaustive list. Okay, then we are using Python and MATLAB and all these languages. So an example of the results. Okay, so we find out that in weather, if we divide it into various parameters, so for example, maximum variability. Okay, so maximum variability is the factor. Okay, so maximum variability means the difference between the temperature, maximum temperature yesterday and maximum temperature today. Okay, so if that difference is okay, negative means the maximum temperature has reduced. Okay, or positive when maximum temperature today is increased than the yesterday. Okay, so you can see it is the most important factor. Okay, and then if maximum temperature is more than 1 degree centigrade, okay, and less than 2 degrees centigrade, then maximum variability, then maximum temperature itself is also affecting number of admissions at the hospital. Okay, while when a patient is at the hospital, how long that patient will stay at the hospital is also affected by the temperature. Okay, so again, okay, maximum temperature is playing the biggest role, not the minimum. Okay, that might affect the minimum nodes as well. Okay, so if the maximum temperature is between 21 degrees centigrade or to 30 degrees centigrade or even more, okay, then only average temperature is affecting. Okay, and when average temperature is between 21 degrees centigrade to 30 degrees centigrade, minimum temperature is also affecting number of admissions. Okay, some more benefits of digital twin are promptly recognizing factors responsible for non-communicable diseases, developing better public health measures and policies, analyzing impact of public health measures, and health fraud detection and prevention. Okay, so these are about satellite for health project and digital twin or digital um, health twin projects. Okay, now I'm not sure if you are still alive. Okay, I can discuss other projects or we can conclude it. If you have any question, we can have questions. Should I continue or?
Yes, sir. Go ahead.
Okay,
Please
thank
go
you.
ahead, sir.
Okay, thank you. So, as we discussed, we use IoT for collecting data. So, just the outbreak of COVID-19 happened in March. We prepared a system, okay, for contact tracing in June. In fact, we published it in June. So, and we got patented it in May. Okay, so May 2020. Okay, So this is not based on mobile apps. Okay, so mm, you don't need actually your mobile phone to carry with you for these types of systems. What we are using were RFIDs. Okay, so we were using RFIDs, which are highly low cost. Okay, so in India that might be 5 rupees per, okay, RFID uh, tag, and there were readers which were little bit expensive but not much expensive, which we can put at various what you call entry points, okay, so that they can read your connections, okay, so they can trace your contacts, okay, and these can also be used with any moving object, not just humans or animals or vehicles, okay. And yes, they are anonymity preserving, okay, so they will not reveal your identity to others, okay. They will only find out the contact, like if you have been in contact with known COVID patient or those who are having a risk of getting COVID. So they have been in contact with someone who is having COVID but not diagnosed as COVID positive. Okay. So this is just an example for COVID, but this system can be used for any other disease, infectious disease. Okay. So they can tell you the risk of developing COVID, or if you need to go through a COVID test. Okay. So they can also find out a flagged or probable or confirmed disease cases, or flagged place or object. So even not only just cases, if you went to a place, because the COVID virus can stay for few hours at a particular place. So if you have been at that place, even you have not been in direct contact with someone having COVID, it can also calculate the risk of developing COVID. Okay. It takes only 25 seconds on Ethereum public blockchain. Okay, that's what we are using for privacy preserving. Okay, so it can also be used for understanding better human connectivity. Okay, model similar other infection spread network, develop public policies to control the spread of COVID-19, and finding super spreader hotspots, responsible behavior. Okay, so this is schematic representation of that. Okay, so as it was saying, disease connection network. Okay, so you can develop that, you can monitor that. If this remains the same or there has been changes, you can track the changes. Then you can share that information with others, analyze. Okay, so how policies will work, how various interventions will work, and learn from that. Okay, if they are working or not, so that you can prepare for future, you can predict and prepare. Okay. And you can continuously use these if you want for developing patient life log, so that it can collect information about medical history, travel history, activities and behavior, and family history. So this is actually an IoT network, okay, which can be part of your digital health twin. Okay, it is also called virtual health twin. Okay, so this is our project paper published, which is open access through IEEE access, so you can go through that. Okay, there are other projects, okay, related to again digital health twin. So here you can get various test results, okay, or tests done without having any human contact. Okay, so by machine, like blood pressure, blood sugar. Okay, and it can identify you so that it can connect you with the right like, okay, first it will open your medical history and will connect you with the right medical professionals or specialists, so you can avoid lot of time waiting to be seen by triage nurse. Okay, so you can bypass that. Okay, so that's what we developed. Okay, so health service, self service kiosk. Okay, so again, this was using various IoT devices. Okay. Then hospital bed occupancy and requirement forecasting. Okay. So we are not only just using weather, but we are using various other factors to understand. Okay. So various. Okay. Pollution, then okay, uh, disease spread other sites, like other countries, or you know, okay, or disease outbreak in the country. So we can estimate how many patients we might expect at the hospital. Okay. Then we developed a mobile app which can help you to make the right decision when there is any medical event. Okay, so which is also part of a digital health twin. Okay, so it can also automatically connect you to the physician if there is an emergency. Okay, it can also track you while you are at the hospital or elsewhere. Okay, so it is having two sides. One is patient side, and another is doctor side. So two separate client applications, you can say. So it has patient dashboard, medication tracker, appointments, symptom diagnostics, video and chat appointments with GPs, doctor directory, patient education, medical and surgical history, disease prevalence statistics, while doctor can see medical records of the patient, okay, medical prescription, okay, tickets of referrals, video and chat appointments with patients, patient diagnosis reports, alerts for irregular or life-threatening vitals, test scheduling. Okay, all these things medical professionals can do. Okay, so patient side, partially, not fully. You might have seen with many other companies in India as well, like I think 1mg. Then there are many companies which are providing quite similar. But yes, this is doctor side as well. Okay, yes, and they are not providing patient education, but here, okay, and because we are working in collaboration with Mater Hospital, so this is more aligned with the healthcare system here. Okay, but we can customize it with healthcare system anywhere else. Okay, now another is to ensure completeness and correctness of data. So we are having this research missing data handling. Okay, so this was in collaboration with Nanyang Technological University, Singapore, Duke, NUS Graduate Medical School, Singapore, and Tan Tock Seng Hospital, Singapore. Okay, so if you collect data, there might be some missing values. Okay, so you can impute that by analyzing various patterns in data. Yeah. So there are various papers we have published. Another is again extension of digital twin. Okay, so we are analyzing previous health records. Okay, so what were the various scenarios? Okay, what was the information available at that time, which led to the decision to the medical professional? So what decision was taken? Okay, and we try to see if our system can learn all these and can take automated decisions based on the previous history. So if there is a new patient which is having some diagnostic results, okay, so it can suggest, okay, what should be the treatment. Even if the patient is there in the system, it can suggest you should we accelerate or de-accelerate the patient. Okay, so means should we reduce the medicine and or discharge the patient, or increase the medicine or change the treatment. Okay, so all these things are again being done in collaboration with Nanyang Technological University and Tan Tock Seng Hospital, Singapore. We are also developing models how the HIV disease spreads, okay, and progress. Okay, so this is again another infectious disease. Okay, so the progress, and some patients respond well to the treatment, some patients do not respond well. So we can find out how the patient will respond to the treatment. Some patients' condition improve through a particular sequence, while some jumps from one stage to another stage. Okay, so we can model what are the factors affecting them. And the most importantly is that only treatment available is antiretroviral therapy. So when is the right time to give that antiretroviral therapy? What should be the CD4 count at that time? So all these things we are doing there. Then we are also analyzing neural activities, okay, to predict epileptic seizure and detect epileptic seizure. So we are the first in the world who were successfully able to predict epileptic seizures with an acceptable accuracy. Okay, so we are using EEG data. Okay, and yes, historical data we are using. So data was provided by Massachusetts General Hospital, MIT, USA, and this is being done in collaboration with Nanyang Technological University. Okay, and funding body is MNNRIDT, a University of Malta. That's University of Malta. Okay, so we are also combining EEG and fMRI because EEG is having very fast temporal resolution while fMRI is having very good spatial resolution while slow temporal resolution, while EEG is having very bad or um, spatial resolution. So that we can, by combination, we can get fast temporal resolution while excellent spatial resolution. Okay. Another is predicting neurological disorders by analyzing social media data and social media activities. Okay, so how frequently you are using social media, okay, then what are the various words you are using in social media or sentences, then your image analysis or your voice and video analysis. Okay, by that, okay, if you change your DP or upload your own video or image, okay, then we can find out if there is a chances of stress or anxiety disorder or depression. Okay. So that's in collaboration with Jivaji University, Gwalior. All right. So I think these are some more. Okay. So that is all. Okay, so now I am here for questions, and thank you for your patience. Okay, being here and understanding, and I hope you find at least some information useful. And you are all most welcome to join me if you are interested to collaborate. Okay. Or if you want any more information about any of these projects, you can ask me now or write me by email.
Any questions from audience? Hello? Any questions from audience?
There is a good number, 67 participants are
Right
here.
now 89, sir, actually.
89, so very good. Yes.
But unfortunately, some technical issue may be reduced, sir.
Okay.
Your
But
session
yes,
is very good, sir.
thank
We are
you.
enjoying to learn. We are expecting more from your end. I think this is the good one from last few days onwards. This is the good session, sir. We are feeling very
you.
proud of you. Proud
Thank you.
to be
My
here.
pleasure.
We are connecting the same platform like you.
Okay, thank you. And yes, just one more. Those who are looking for postdoc or PhD can also contact me because we are regularly having demand for more and more researchers. Thankfully, we are
Yes.
getting funding to support them. So
Yes, sir.
even the Marie Curie College open, so we can even pay them for coming here, preparing the proposal.
Sir, any funding also available, sir? If you they are
Yes,
wanting
that's
to.
what I'm saying. So we can offer funds, but yes, these are open competitions. So, you have to apply and we will see your application in comparison with other applications. Okay. And
This is
yes,
very
I'm
good
not the
opportunity.
only one to make the decision. So there is a board, but yes, I
Yes, sir.
can
This
always
is very good
network.
opportunity, sir.
Thank you.
This is very good opportunity.
Thank you. Even this research is not only done by me only. We have a team of researchers like
Telsius
PhD.
sir already told me, sir, regarding your appreciable work also.
Thank you.
Very nice to meet you, sir.
Thank you. All the very best, everyone. Once again, thank you for your patience and feel free to contact me. Mainly by LinkedIn, you can better contact me, but you can also write an email.
Yes,
Yeah,
sir.
sure, sir. Thank you, Dr. Lalit Garg, sir. Thanks so much for taking the time to speak in the conference. Your insights and your perspective are truly valuable, and we're all engaged by your presentation. It was a pleasure to have you with us. Your passion for the topic is connected data analytics and virtual health claims, and its application various domains really came to new worlds, and we are all grateful for knowledge and inspiration. So your contribution to the event was valuable. Thanks for the introduction of the discipline of the Earth and Saturn for Health and Destination Earth projects, solve the existing problems, and for the introduction of the new funding projects. So again, thank you for your time and for sharing your expertise with us. We hope to have the opportunity to work with you again in the future. Sir.
Thank you.
Thank you very much, sir.
Thank you.
Again, all the very best. Okay.
Thank you,
Do
sir.
your best for whatever you are doing. And
Yes, sir.
don't hesitate to seek any support or advice or I don't know, whatever I can contribute with.
Sure, sir.
Okay. So
Yes, sir.
thank you.
Definitely, I will be in touch with you, sir.
Thank you. Good day.
Thank you, sir. Good day, sir. Participations, please fill the feedback link. And right now, our session is concluded. The next session will be started around 3 o'clock. Okay, please fill the Google form, feedback form. Okay, thank you very much. If any queries from audience, hello, hello. Any queries from audience? Hello. Okay, thank you very much. Any suggestions regarding our publication like that? Any doubts regarding the publication indexing? Any doubts? Any presentation issues from your end? Discuss with me. If you have any doubts, please ask me. Okay. Can I leave? Thank you very much. Next session will be started nearly. Thank you very much. Thank you, sir. Next session will be started around 3 o'clock. Talk taken by IIT Roorkee, Senior Professor. Thank you very much. Thank you very much.